Wallen, and this will be my head, eyes, ears, nose, throat, skin, and neuro assessment video. If I could ask the recorder to please look around to make sure there are no cheat sheets. And this is the recorder to make sure they don't have any cheat sheets on them. First, I would check the patient's chart. I would then wash my hands, which provided privacy by closing the door. Can I confirm your name and your date of birth, please?
Teresa Erling, 12/23/70.
Okay, thank you. My name's Brett, and today I'm going to be performing an assessment from your neck to the top of your head. I've gathered my tools, which is a Q-tip and a pen light. And what brings you in today?
Just an exam.
Just the exam? Are you in any pain right now?
No.
Okay, if the patient had been in pain, I would have found out where the pain is located, if it's radiating anywhere, the provoking factors, the palliative factors, medications they may be using, the quality and severity of the pain, and when it had started and how often it comes around. So we're going to start with your head and your face. And have you had any issues with pain, tingling, previous head traumas?
No.
No? Okay. And I'm going to start by palpating your head. Is any of that tender?
No.
Okay. Skin is warm and dry. The hair is evenly distributed and soft to the touch. There are no lesions within the skin. The skin tone is appropriate for their ethnicity. I'm going to start by palpating your temporal artery. The temporal artery is equal bilaterally with a +2. And can you go ahead and move around your jaw for me? Any pain?
No.
There's no sign of crepitus within the temporal mandibular joint. Now I'm going to use this Q-tip and I'm going to touch different spots of your face, and I need you to tell me if it's soft, dull, or sharp, and also where it's located.
Okay.
Close your eyes.
Left lower jaw, sharp. Soft on the left cheek. Sharp on the left forehead. Soft on the right cheek. Soft on the right jaw. And sharp on the right forehead.
Okay. Cranial nerve 5 is intact. Can you raise your eyebrows? Lower them? Can you smile? Frown? Can you puff out your cheeks? Cranial nerve 7 is intact. Next, we're going to move to the neck. We're going to start with the lymph nodes. There's the pre-oratorial, post-oratorial. Can you lean your head forward? Occipital. Okay. Then there's the tonsillar, submandibular, submental, superficial cervical, posterior cervical. Can you lift your shoulders up and push them forward? Supraclavicular. Okay. I'm going to test skin turgor. There's no tenting. The skin moves right back and is easily movable. Can you turn your head to one side? And there's the deep cervical and the other. And the other deep cervical. None of the lymph nodes were palpable. If they had been palpable, as long as they were smaller than a pea and movable, they would have been fine. Now I'm going to check your thyroid gland. So if you can just relax your neck, bring it just a little bit forward. Thyroid gland is non-palpable. Can you move your head around for me? Doesn't appear to be any limited range of motion within the person's neck. And can you push against my hand? And the other side? And shoulders? Cranial nerve 11 is intact. Next, we're going to move on to your eyes. And when's the last time you went to the eye doctor?
Within the last year.
Within the last year? Okay, and did you use a Snellen chart while you were there with the letters on it?
Mm-hmm.
Okay, and you did fine on it?
Yeah.
Okay. Cranial nerve 2 is intact. Have you had any tingling in your eyes? Any weird sensations?
No.
Do you wear glasses?
I do.
Okay. And they're a good prescription?
Yes.
Okay. Next, I'm going to shine a light in your eyes to see how the pupils react. Pupils are equal, reactive, round, to light, and direct and consensual. Can you look up in the top corner for me? I'm going to put my pen light right here. And when I say now, I want you to focus on my pen light. Now. Pupils are also reactive to accommodation. The eyelashes and eyebrows are evenly distributed, symmetrical. The sclera is white and clear. The cornea has no opacities. Can you pull down your eyelids for me? Alright. The conjunctiva is pink and moist. Next, we're going to do the range of the 6 cardinal gazes. So I need you to focus on my pen light and follow the pen light without moving your head. Cranial nerves 3, 4, and 6 are intact. Next, we're going to go to your ears. The ears are symmetrical, of normal shape. The top of the ear is in line with the outer canthus of the eye. There's no excessive drainage, no cerumen buildup. And check the other. The same goes for that one. There's no excessive drainage, no cerumen buildup. Now I'm gonna push, pull, and push on different parts of your ear to see if there's any tenderness. So if there's any tenderness, just let me know. I've pushed on the tragus, pulled on the pinna, and pushed on the mastoid process. Have you noticed any diminished hearing, any earaches, excessive earaches, loss of balance?
No.
No? Okay. So if I could just have you step down and just face forward, and I'm gonna say words behind you, and I need you to tell me which ear you hear it in and what the word is.
Okay. Left ear apple. Right ear banana.
Okay. And can you close your eyes while still staring forward? Okay, thank you. You can go ahead and have a seat. Cranial nerve 8 is intact. Next, we're going to check out the nose. Have you had any pain in your nose? A history of nosebleeds?
No.
Okay, and any other sort of issues with your nose?
No.
Okay. The nose is symmetrical. Doesn't appear to be any deviations. Outside structures are free of lesions. I'm now palpating the frontal sinus. Any tenderness?
No.
Now I'm palpating the maxillary sinus. Any tenderness?
No.
Okay, now I'm going to check inside. No excessive drainage. Hair is equally distributed. There's no deviation of the septum. Alright, just keep looking forward. There are no perforations within the nose. Have you noticed a diminished sense of smell?
No.
Cranial nerve 1 is intact. Alright, next we're going to go to your mouth. The lips are pink. Can you go ahead and open your mouth, stick your tongue out? Say ah.
Ah.
Okay. You can close your mouth. Have you had any trouble swallowing?
No.
Okay, cranial nerve 9 and 10 are intact. Can you say the phrase back to me? Light, tight, dynamite.
Light, tight, dynamite.
Cranial nerve 12 is intact. The teeth were intact. Buccal mucosa was pink and moist, along with the hard palate and soft palate. Soft palate and uvula rose upon saying ah. That shows one of the cranial nerves. The pharyngeal wall was free of irritation. It was pink and moist, had no foreign bodies on it. Can you pull down your lip? And pull up. Gums are pink and moist, intact. Throughout the entire assessment, I noticed that their skin was clear, had no lesions on it. Patient's posture was erect. They're dressed appropriately for the situation and the season. They're well groomed, clean. Their speech is clear for their behavior. They had very deliberate and smooth body movements. Can you tell me what season are we in right now?
Winter.
Okay, and can you tell me where we are right now?
Lapeer, Michigan.
Okay. Patient is alert and oriented to person, place, and time. Throughout the assessment, they had clear and logical thought processes, and that'll conclude my video. Thank you.